Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're going to go over what is the best way to treat a case of neck pain that also has a headache. So the first step here is the goal is to fully solve the root cause of your headache and neck pain, and then treat it and be able to get you that long-term outcome to make sure that you don't get any exacerbations or flare-ups here and there. So if you solve the root cause and you address your risk factors, you should be able to get your symptoms fully resolved and get that good long-term outcome. Now, headaches are a very complex diagnosis or case. Okay, there's so many different types of headaches. There's multiple causes. Okay, so one of the headaches that my team and I really specialize on is called a cervigenic headache, meaning the headache is coming from the neck area. And a lot of times you'll have complaints of the headache that's just along the back of the skull. Sometimes it's a referred headache where you'll feel like a tension type headache across your top of your skull or your forehead area. Sometimes you even have, it's almost like a ram horn where the headache starts on one side of the neck and it comes up the back, and it comes sometimes behind the eye, where people will say where they feel a lot of pressure behind the eye. So the key with understanding these is the root cause is in the neck. It's not over here. So there's a lot of times where people say, well, I had a massage here in the temple, but it didn't change my headache. Or I massaged here and it didn't change my headache. That's because the root cause is here. The research shows that it's actually most notably the upper two levels of the cervical spine that is responsible for a cervicogenic headache. So the key of where you want to treat is the suboccipital muscles or even the upper cervical spine. And what's even better is when you treat this area, does it change your headache? There's plenty of times where someone will come in with neck pain with a headache that's a 5 out of 10 pain. I treat the neck here and instantly it makes the headache go away. And that's your first step, is when you treat the neck and the cervical spine, can you make a change to your headache, and can you keep treating it to a point where the headache starts to go away? Sometimes with some chronic cases it may take a few visits to do this. But within the session, you should be able to make a change to your headache, and that will prove that it's coming from the neck and the cervical spine. So you keep treating that, and you have to resolve the headache first until you only maybe have just a little bit of neck pain. And then the next step is to treat the neck pain and to make sure that goes away. A lot of times, you'll run into this when people will go back to work, go back to an activity too early, and their headache and their symptoms come back. So you do have to address some risk factors, like workplace ergonomics. Make sure the computer height is okay. Make sure that they're not going back to their same old habits, or the symptoms will come back. So step 3 is going to be make sure that you resolve the risk factors that predispose that headache to come back. And then the last step is to make sure you address full neck range of motion, and then you can start off with, finish off with some strengthening. And that's what's going to give you your great long-term outcome, is if you can get to a point where you have full neck range of motion and you have great strength and you solve the risk factors, you should be able to get to a point where your cervigenic headache, or your headache that's coming from the neck, is fully resolved, and you can get back to your normal lifestyle and your favorite activities and exercise without flare-ups or recurrence rates of headaches and neck pain. Another crucial step is make sure that you're being treated by the expert who's doing interventions that are proven to work to get the long-term outcome. There's plenty of times where I hear patients saying that I've had neck pain for 5 months, I've been being treated for 5 months, and they still have the neck pain. That means to me those interventions are not solving the root cause of your pain, and they're just masking symptoms or covering up pain. So it's essential and crucial to make sure that you're being treated by the best clinician who's solving the root cause of your pain. Here at Pursuit Physical Therapy, our team is made up of only board-certified orthopedic clinical specialists. So rest assured, if you come here, you will be seen by the board-certified expert. And we don't hire techs, we don't hire assistants, and we never double or triple book our patients. Our goal is to solve the root cause of your pain and make sure the pain doesn't come back, so you can get back to your favorite activities, get the long-term outcome, and get back to an active and healthy lifestyle that you want to live. So just look at the testimonials below and see what some of our past patients have said about their experiences here and some of their outcomes. And if you're ready to get started to resolve your neck pain, you can give us a call today at 407-494-8835, and we'll get you in for a thorough assessment and we'll solve the root cause of your neck pain. I hope you enjoyed this video, and thank you for your time, and hopefully we'll be seeing you soon.